This is an explanation of how our jaws and our bite and our teeth work. Whenever we move our teeth, we move the whole lower jaw. It hinges in the TMJ, the temporomandibular joint. This pink line illustrates the stable bone brace position of the TMJ. Unlimited force upwards won't displace that joint. That's where it belongs. But for most of us, the stable place for the jaw joint does not coincide with the stable place for the bite, because teeth often don't always erupt in perfectly and stay there for a lifetime. So we have to have some means of compensating for this. Millions of nerve endings around the roots of the teeth sense that if the teeth aren't lined up properly, that they send a signal to a muscle that lies horizontally, which I call the horizontal positioner muscle. That muscle, when it contracts, it pulls the jaw forward. Okay, so we can then be adapted to the correct bite. By the way, this joint is a joint that first rotates and it also slides. And when we open wide, it does that. It opens like this. That involves contraction of that horizontal positioner muscle to pull it forward like that. So let's repeat. When you close together, if the teeth don't all lined up, they send a signal to a muscle that lies horizontally. It slides the jaw forward until the teeth all fit and function. Now, that's all great. We live and function like that. However, it's not a bone brace position. It's a muscle brace position. Muscle effort's required to keep it there. So this muscle can get tense. And when it does, the powerful chewing muscles, which are also part of the whole system, they get tense too. When they squeeze, they close the teeth together, but they also lift bodily on the mandible, which drives the joint back up to here. Then the teeth would say, oops, we're not lined up. Send a signal to this positioner muscle. It tightens up again and shifts you this way. This makes the powerful chewing muscles even more tense, and they squeeze to try to compensate. And we get into a tug of war between the openers and the closers, which results in grinding and wear and tear of the teeth. Now, what we want to see is when you put your teeth together, the stable place for the bite coincides with the stable place for the jaw joint. Then you have structural stability. That's really nice, but most of all, you have muscle peacefulness. The muscles are not in conflict, meaning that you're not going to be grinding the teeth so much. Another benefit of the jaw being in joint, and reason for having it be correct, is that when it's not in harmony here, eventually this meniscus or disc, which is made of cartilage, gets pulled out of place. And when it does that, we can end up either partially or entirely onto the bone. Okay? So that does not result in a real stable environment. If that happens, you can see the changes that can occur. I'll illustrate it this way. This is a bite that's in good shape already, but if that disc gets pulled out of place, then you see that it hits harder on the back teeth and more open on the front teeth. And that's the scenario that we're talking about for you. But the name of the game is to have everything balanced, with the bite balanced with the jaw in joint. Then you have the longevity of no wear and tear on your teeth and on your joints.